Good afternoon, broadcasting live from the ZTN studios in Harare, Zimbabwe. Welcome to Thriving Heals, the women's show brought to you specially by Zimpapers TV network. My name is Candice Mwakliele. Now, October is Breast Cancer Awareness Month. And this week, we've chosen to go with the theme, the breast cancer story, fighters and victors, because we want to celebrate the women that have traveled this journey of fighting breast cancer and have won the battle. But we also want to look at the women who support them along this journey, because it's not an easy thing to encounter, especially when you're on your own. It not only takes a health toll on you, it does take a mental and emotional and physical toll on you. So you do need a support system and someone to guide you through processes. So today we are focusing on celebrating that. Now, according to an original research by Cancer Medicine, first published on the 10th of May in 2021, breast cancer is the second most common cancer among women in Zimbabwe. Now, patients face socio-economic barriers to accessing oncology care. This includes radiotherapy. And there were an estimated 2,000 incident cases and more than 900 deaths in 2018. Though only a fraction of these patients are documented as presenting to care with a breast cancer diagnosis. Now, as we mentioned, we are looking at celebrating those who have managed to win this battle, and of course those who've been holding the hands of several patients as they travel through this journey of beating breast cancer. In studio with me, I have oncologist Dr. Nomsa Tsikai and breast cancer survivor Hajne Matonda. Ladies, welcome and thank you so much for joining us today.
Thank you so much, Candice.
All right. Just to start off, maybe you could, Dr. Nomsa, maybe you could start off with giving us just maybe a general, I know I've given a brief, but just a general outlook of breast cancer in Zimbabwe as we stand today.
Yes, thank you, Candice. So like you mentioned, breast cancer is the #2 cancer in Zimbabwean women. Worldwide, it is the #1 cancer that's affecting women. So in Zimbabwe, we have cervical cancer as #1, accounting for about a third of the cancers in our women, and that's followed by breast cancer. So it is causing a lot of morbidity. We're losing a lot of women to breast cancer, and most of them are young women in their reproductive age group, which is a problem. We're seeing 20-year-olds, 30-year-olds, 40-year-olds who are mothers, wives, sisters, daughters that are losing the battle. So in Zimbabwe, the problem is a lot of our women actually coming late.
Right.
Yes. So 80% of our women come with stage 3, stage 4 breast cancer. So just to mention what cancer is so that the public has a general appreciation. So with cancer, what we have is our breast cells. They develop an abnormality that allows those cells to start growing uncontrollably. So from something that we cannot see, that's microscopic, one cell becomes 2 cells, and that continuous growth now becomes a lump that one can feel or see even. That lump can grow bigger to cause growth or swelling of the breast. And the unfortunate thing with breast cancer is that those lumps can actually get into our blood vessels and spread to other parts of the body.
Right.
That is what makes this disease life-threatening. So we lose a lot of patients because that cancer would have spread. Hence the need for early detection. When I mentioned that our women are presenting late, they present once the cancer has spread. And the unfortunate thing is we are not able to cure cancer that has spread.
Right. Haji, before you got your diagnosis, how aware were you of the existence of breast cancer?
I was aware, but from the awareness, but I thought that it would not come to me.
Right.
Yes.
And this is one of the reasons why it probably, people will present late. They know of the existence, but you're like, oh, it's not something that I could possibly. Now, what are some of the factors that make you, apart from just being a woman, what are some of the other factors, lifestyle conditions that contribute towards you being at risk of breast cancer?
Yeah, so the thing with breast cancer is anybody can develop breast cancer. And men can also develop breast cancer, but it's more common in women. So by just the virtue of being a woman, we can develop breast cancer. But the things that we say we cannot control and things that we can control. So these are predisposing factors or risk factors. I have a number of women that come to me and they say, Doc, I have done everything right. I've been eating right, I've been exercising, I have, I've just done everything. Why did I develop breast cancer? So a lot of the times it's those things that are not within our control. So number one is aging. As we get older, there's wear and tear on our body parts, and the breasts are not exempt. So they do tend to develop these lumps. So we're looking at ages from 40 onwards.
Right.
We start developing these lumps. And also genetic factors. Sometimes one is unlucky to inherit a bad gene within their breasts. We call these BRCA mutations. So if one is born with that gene, the likelihood of developing breast cancer is that much higher. So how one can actually suspect that is if you have a strong family history of breast cancer. It's very important to talk to your family members and to find out which cancers are prevalent in your family.
Right.
Yes. So here you find that you can say your mother had breast cancer, her sisters could have had breast cancer, your grandmother breast cancer. So you actually literally see this as something that's going through your family line.
Right.
Yes.
Right.
So if you have that, then you have a higher risk of having inherited or been born with this mistake within your breast cells that predisposes you to developing breast cancer. Those things we can't do anything about, but it's important to have the knowledge, the awareness, so that you start going for screening earlier, especially if you have a strong family history from the age of 30 years of age. And average risk from 40 years of age onwards for our screening measures that we will talk about. And then there's other things that we can actually control, which are majority of the factors. So these are lifestyle factors.
Right.
Yeah, so things that we have control over, the choices that we make on a day-to-day basis. So the foods that we eat, are we eating right? We find foods that are rich in greens, your vegetables, fruits. They can actually be protective, because within our bodies, we have toxins that we accumulate day to day. So these healthy foods have antioxidants, which go and mop up these toxins that can damage our cells and actually can prevent or reduce the risk of breast cancer. And there are foods that can add toxins. So that's your oily foods, some of the fast foods can actually add toxins to our bodies. We're looking at processed foods. So we need to actually look out for that and reduce or cut down on processed foods. And then things like alcohol drinking, cigarette smoking, those also add toxins to our bodies that can damage our cells and initiate the cancer process. And I'm also happy to say that research has found that exercising reduces one's risk of developing breast cancer and other cancers. So that is something that, is free, available to all of us.
Anybody can do it.
Exactly. To just make an effort every day to get out of bed, go and get some fresh air, exercise, whether it be walking, running, going to the gym.
Any form of movement.
Any form of movement. It actually helps to reduce the risk of breast cancer. And with that, things like obesity, we find that especially after menopause is when women stop having their menstrual cycle, which usually happens between the age of 45 to 55. After menopause, being obese, that's having your body to your mass index being higher than 25. So there is a calculation that we do. So you go to your doctor, but nowadays we have it online, calculators that you can actually use, measure your weight, your height, and then you calculate your body mass index. If it's higher than 25, then it means that you have excess fat cells. And those fat cells produce excess hormones.
Right.
And
that presents a risk in itself.
Exactly.
Okay.
And breast cancer is a hormonally driven cancer. So when we have excess hormones within our bodies, now being produced by the fat cells, they go and feed our breast tissue and cause cancer. So it's very important to actually reduce obesity, manage your weight.
All right, so we've gotten insight into just some of the factors that may put you at higher risk, and also just a few hints on what to look at if you're trying to prevent it. But Haji, let's have a little bit about your story. Did you have a history of breast cancer in your family? Had you ever bothered to ask, or was it just something you figured, it can't happen to me, and I'm not sure whether it's happened before, but I'm not really interested in finding out?
Okay, in my family, my sister had a lump, but fortunately she managed to have it removed when she was still very young. And then for me, I had a lump. I ignored it because when she had a lump, I was still young.
Right.
So she only remembered when I had breast cancer that, oh, she also had a lump. So for me, the lump was not painful, so I didn't do anything about it. And then 2 years later, the lump started to grow. Then I got worried, but it wasn't painful for me, to just a lump. So I was actually shocked when I was then told that the lump was now cancerous.
Okay, from the point that you discovered that you have this lump, you've mentioned it starting to grow after about 2 years since you first mentally noted it, but you didn't do anything about it during those 2 years. It wasn't painful. It started growing. You still didn't do anything because, again, it wasn't painful. At what point did you now start to think, okay, I should probably have this checked?
I think the awareness programs, that's when I said maybe I should just go ahead and have it checked. And also because I'd had a baby, so when I was pregnant, the lump was actually growing faster than before.
Okay.
So it actually allowed me to go and get medical attention.
And as you were going for your screenings, or not for your screens, for your checkups when you were pregnant, it never came up in the conversation with your doctor. You never mentioned it, and there wasn't any visible difference?
It never came up, but when I was now breastfeeding, I asked my doctor, and the doctor actually suspected that maybe it could be the milk, the clot.
Okay.
Yes, for since I was breastfeeding. But back of my mind, I knew that I had the lump before. So I then went and have it myself checked with another doctor at Corporate 24.
Now talk us through the screening process. How was the screening process for you? How were you feeling as you were going through the screening process? Did you imagine at all that this is what it could be, or did you just feel like, oh well, I'm just having a routine check because, well, it's what's going on and I have this lump, I don't know what it is, but let me just check anyway?
Okay, because of the size, I thought it could be, but it's just a thought. But I thought that it's just a lump that I need to get rid of before it gets cancerous. So I went for the screening, the biopsy, and after that, that's when I was told that it was cancerous.
Do you by any chance know at what stage they discovered it for you?
Yes, it was at stage 3.
It was at stage 3?
Yeah.
Okay. Doc, let me come back to you. I ask her what stage because, as you've mentioned, ladies tend to report late. What are the stages and what are the possible effects especially on treatment of the different stages of breast cancer? What are the stages that we move through?
Yes, so we've got 4 stages of breast cancer. So we are saying by stage, we just mean how advanced is the cancer. So stage 1, that's when the lump is just limited to the breast. So we're looking at a small lump less than 2 centimeters in size. Stage 2, our lumps have grown beyond 2 centimeters or spread to the nearby lymph glands. So we're looking at the breast. We've got our vessels, so there's escape of the cancer cells into those vessels. It tracks up to our armpits.
Right.
So when it's still early spread to 1 or 2 lymph glands, that's stage 2. But more advanced stage within the armpit, that's more lymph glands or lymph nodes that are involved. That's stage 3. Sometimes we can even find 20 out of 20 lymph nodes that are involved. So women come with a lump within the armpit.
Right.
So that's stage 3. And then stage 4, the cancer has spread beyond the armpit, gone into the blood vessels. It mixes through the heart, goes around the body, and looks for a distant organ to sit in. Most commonly for breast cancer, that happens in the liver, the lungs, the bones, and unfortunately also our spinal cord or the brain. So when that happens, the chances of cure are limited. So our staging is very important. As you can see, as I went through from stage 1 to 4, we're seeing how far spread, far gone the disease is. It also now directs our treatments.
Right.
Yes. So when we are still localized to the breast, that's stage 1, then we can just operate and remove that lump. And for a lot of women, that's adequate. It's important. It's important to know, because then the risk of it having spilt into the rest of the system is limited. So we don't need any other treatments. So surgery can work on its own for stage 1, which actually makes it cheaper for a lot of patients.
You're right.
But when we catch the cancer later, stage 2, stage 3, it's gone to the lymph glands. Operation is not enough. So it's important for women to know, because I do find a lot of women come, they've had the breast removed, they've had the lump in the armpit removed, those are the lymph glands.
Yeah.
And there is nothing. We do scans, there's no cancer anywhere. And they say, you want me to have more treatment? Chemotherapy, radiotherapy, why?
Why, yeah.
Show me where the cancer is in the body.
Yeah.
You know, so it's important for us to know that the moment it's tracked into those vessels, the risk of spillage into our bloodstream is much higher. So stage 2, stage 3, we've got to go beyond surgery and clean up the system using chemotherapy, which are drugs that we give either as pills, but most commonly as injections.
Right.
So just a drip that we put through. It runs over 3-4 hours every 3 to 4 weeks. So the 3-week breaks are just to allow the body to recover. Yes. So the chemotherapy targets fast-growing cells. So cancer, by definition, are the fast-growing cells, and kills them. So we want to reduce the risk of any of those fast-growing cells that would have spilt into the system, reduce the risk of coming back in future. So what we call the recurrence rate. So chemotherapy helps to do that. And then radiation, especially for stage 3 patients that would have come with a big lump in their armpit, or that would have come with big tumors, we need to give radiation. Radiation is using special X-rays to treat cancer. So just like you have your normal X-ray, it's similar X-rays, but with radiation treatment, the X-rays are higher energies they treat. So we direct them to where we want to treat. So for breast cancer, we're saying it's the chest wall, the skin that is left. We want to clean it up with these X-rays, and we also direct it to the armpit and the neck area here, where the lymph nodes can track up. So we also treat that area with these X-rays. Radiation, one doesn't feel anything during radiation. A lot of people fear radiation, and they think they're going to feel burnt, like they're going to piswa. Yeah, so we have to reassure patients a lot to say, no, you actually don't feel anything during the treatment. But it is cumulative, it accumulates. We treat it slowly, every day, Monday to Friday, over 4 to 5 weeks. So it does add up. So over time, there is darkening of the skin that you start to see that something is happening. Yes, but that darkening heals quite well. Yes. So the radiation is to mop up any cells that may remain after surgery to reduce risk of now local recurrence of disease. Chemotherapy, we're reducing risk of distant systemic recurrence of disease. Those two things.
So they work hand in hand to just kind of make sure you do not have a recurring case.
That's important. So we need to achieve local control of disease and distant systemic control of disease. And when we find a patient with stage 4 cancer, we're saying here it's already gone distant or systemic. So we need to give treatments that also just go around the body to where the cancer cells would have gone to. So that's usually chemotherapy. For some patients that have what we call hormone positive cancer, we give them hormone positive. We give them hormone treatment. So hormone positive cancer, like I mentioned before, breast cancer is hormonally driven. So on the cancer cells, we check for hormone receptors, estrogen, progesterone. We also check for what we call HER2 status. These are little markers that are on the cancer cells. So if they are present, for women with stage 4 breast cancer, we can give them pills that go and block these receptors and cause death of the cancer cells. And we treat patients. We have patients, even with stage 4 cancer, that have survived 5 years, 10 years on our treatments. So it's important to know that even if you have stage 4 cancer, research has actually gone a long way to making sure that we prolong lives as best as we can. So come and we talk and we offer you treatments and follow you up.
Right. All right. We are taking a short break. We have looked just briefly at the basics of what breast cancer is and talked about the different stages that you go through and the possible treatment options that are available. When we come back, we are looking at the emotional side, the emotional toll that it takes on an individual. Do stay tuned. Welcome back. You are watching Thriving Heals on Zimpapers TV network. I hope you are part of the discussion. The comment section is open to you. Your questions, your queries, that is on the Zimpapers TV network Facebook page or on Twitter at ZTN News. Today we are looking at the breast cancer story, fighters and victors, and we are really just trying to not only just educate you but also celebrate those who have managed to win the battle against breast cancer, as well as acknowledge those who have had to hold their hands throughout, be it family, be it the doctors. And today we do have oncologist Dr. Nomsa with us and survivor Hajine, and we are talking to them. Now we've looked at the basic information that we need, but now we want to look at the emotional side of things, and Hajine, this is where we're going to drag you in a lot, and I hope that we're not taking you back to a bad place, but we do want to kind of understand the the mental side of things, what people go through when they're dealing with this, and I want to ask you, from the moment, okay, you've gone for your screening and you're waiting for your results, what was that waiting period like?
The waiting period, because I didn't expect that I have cancer, so it was just normal.
It was a normal time?
Yeah, because I was expecting that the doctor was going to say, okay, you've got a lump, we're going to have an operation to just remove it. You don't need the lump.
Right.
So I didn't expect that. I had cancer.
And you were breastfeeding at this time?
Yes, I was.
Okay. And the day you got this news, what was your first thought?
I was shocked initially, and then I went blank, and because I remember when the doctor announced the news to me, I just looked at him, and he asked me if I had any question I didn't have at that time, because I was shocked. And then after that, I went into fear mode. I didn't know if I'm going to survive, am I going to die, what will happen to me. You start recalling all those movies that you watched about people with cancer, vomiting, losing their hair. So I was very afraid initially. But I want to thank God that I managed to win that battle through knowledge. I researched about what cancer is, how can it be treated, where, when can I start treatment. So that actually helped me a lot, and that's how I managed to travel my journey.
Did you go with anyone to this appointment, or did you go alone?
At first, because I wasn't expecting anything, I was alone. And thank God for the follow-up meeting, follow-up appointment with the doctor the following day. Because when I went home, I had people who were asking me what stage, what kind of breast cancer it is, and I was blank. So the following day I had to go there with family, and I was able then to ask the relevant questions, the staging, the type of cancer.
And that day, when the doctor gave you your results, apart from just asking you if you had any questions, did they talk you through any process? Did he give you any form of light counseling? I mean, clearly you were in a state of shock.
I was in a state of shock, and unfortunately the doctor who announced the news, I'm not sure if he was in a hurry or not, but he just said yours came a bit early, because at that time I was 37 years old. So he just said yours came a bit early. Normally, like what Dr. Tsike was saying, we expect cancer at around 40 years. And then I was 37 years. So he just said yours came a bit early, and you know, cancer, it travels very fast in your body, and you have to have an an operation. It was on a Thursday, and then said we have to book you on the following Monday for an operation. So it was too fast for me to actually digest.
Do you feel it could have been handled differently?
Yes.
How do you think it should have been handled, and would it have made a difference to how you had felt?
Maybe the doctor could have maybe explained to me what cancer was, because at that time the doctor actually said, okay, so we are going to have a mastectomy, and to me the word mastectomy, it was the first time to hear about it. So he's trying to tell me, you know, there's that gap where the doctor knows and much about this disease, and the patient on the other hand
knows nothing.
And even if you ask the questions, you don't know what to ask.
Right.
It's only after that, the following day, that I to ask about the staging, because somebody in the family had asked me about the staging of my cancer. But before that, I had
nothing. You had no information.
I had no information, even the questions to ask the doctor. So I just said, no, I don't have any questions. And then I moved out.
Dr. Nomsa, what we're kind of identifying here is a bit of a gap in information between doctor and patient. When you go through your education process and your trainings as oncologists, is there any room that helps you deal with patients who come, and because it's going to be a shocking bit of information, and kind of like how we deal with HIV and AIDS, you do need that instant support, you know, and you're not always going to figure out that you should come with someone, but the doctor then plays a vital role in giving you some of the information that you need. Do doctors get training for that?
Yes, we do get training on how to break bad news, because a cancer diagnosis is bad news, because that changes one's life, you know, from the moment that you're told that you've got cancer. Like as we mentioned, a lot of things go through your mind, and a lot of it is, will you survive, will you not? And, you know, then the treatments come through, and the options, and it's a whole lot of things. So we are trained on how to break bad news. But like she mentioned, that the doctor may have been in a hurry. So maybe the doctor had a busy clinic. That does happen. We do have organizations that are supposed to come in and fill that gap. I remember the Cancer Association, at some point, they would actually try and identify which patients had been diagnosed with breast cancer, and actually go to those patients and say, we were told that you've just recently been diagnosed with breast cancer. You know, so these were then also breast cancer survivors that would have survived 5 years, that volunteer their time to go and sit with a newly diagnosed patient to fill in that gap. Take the patient through their own journey, you know, what sort of things to look out for, what to ask, what to expect with the operations, the mastectomy that she's, you know, they can even just show them, look, this is what it means to have mastectomy. Don't worry, you will live, you'll survive. I went through chemo. So that then lifts one up from that pit that they would have been in. So yes, we do need to resuscitate some of those important initiatives that were being done, or to strengthen them and support the doctors that are actually getting these results and having to give the patients. So the organizations have to go to the surgeons, oncologist rooms. It is something that we definitely have to work at and fill in that gap, because it is somebody's life, somebody's family, and the impact can be just devastating.
Absolutely. And for you as an oncologist, and you've had to break this news several times, how have not just the reactions, but even just the thought of giving this bad news, how has it affected you outside of the fact that you're trained to break it?
Yes, that is difficult. So what happens is, we have the knowledge. So some of that knowledge that you have, it's very difficult to let the patient know the full impact of their stage, their diagnosis. So a lot of the times we have to actually break it in a gradual manner. So I see a patient, I know that they've stage 3, you know the survival rates, you know the treatments, you know somebody, like she mentioned, that she just had a baby, and you're looking at the baby, you're looking at her and thinking the survival is now limited. So all that knowledge that we have, it's a huge weight on us. So we do take time to develop rapport with the patient, with her family, get to know them better, and then we sort of take them through over time. Yeah, so we don't just, just give it all to them at once. Early on in my, in my profession, I would do that. And you actually sense at the end of the day that a patient is overloaded.
Right.
When you're asking them, do you have any questions? You'd have just given them too much from the cancer, what type it is it hormone positive, their stage, their survival rate, they just overloaded. So we do actually develop that relationship, and we break it to them slowly. Yeah, so that relationship, just touching on that relationship that we develop with our patients, it does take a toll on us, because when our patients come late, we do lose quite a number of our patients.
Right.
Because when they come with stage 3, stage 4, we do fight and save a lot of patients, but we do also lose quite a number. And that does take a toll because of that relationship that you would have developed with somebody over years and their family members. So we also need counseling, and I always encourage doctors that deal with cancer or other oncologists. We do have seminars, workshops, where we also go for debriefing and counseling, so that we strengthen ourselves and are able to keep going and not become cold-hearted and just, treat patients like statistics.
Right.
Yes.
Right. Haji, take me through your training. So from the not your training, your treatment. So you go for your follow-up, you ask your questions. Obviously, they're not going to be enough in one sitting. There's always questions that arise. But take me through from the time you had your mastectomy, what else did you have to go through? How did you feel through that whole process?
Okay. After the surgery, I then started my chemotherapy, because mine were discovered late at stage 3. I went through 16 cycles of chemo. So the whole treatment, it took almost 2 years. And then after that, I had radiotherapy. And then after that, I was taking a tablet on a daily basis for 5 years. Yeah.
Doc, the duration of this treatment can sound very long and very overwhelming to somebody, especially when you have to take them through, okay, so this is the stage that this is how we're going to treat you, and this is how we're going to treat you. Number one would be, what are the risks of them succumbing during that treatment? And number two, when we look at Zimbabwe, are we well equipped for these long periods of treatment for our breast cancer patients?
Yes. So with cancer treatment, I always just tell the patients when I see them the first time that it's a journey that we're embarking on, and not just hit and run. You just come and you go, no. We are together, and I always joke to say we're going to grow old together, because you're looking at 5 years, 10 years together. The treatment can be maybe 6 months, but we always have regular follow-ups after that to just make sure that the cancer is not coming back if it does come back, so that we pick it up early. So it is a journey. Yeah, so I prepare them for that. So once we embark on this journey, there are certain risks that come with it. So the chemotherapy treatment does come with its risks. So what we do before we even embark on the treatment is a risk assessment. We say, what is the risk of the cancer coming back? And coming back in a way that it will kill you. It's risking your life. So when we find that this risk is significant enough, then it warrants us going through these treatments. So the treatments, chemotherapy, radiation, we do make sure that we tailor them to the patient so that the treatment is safe. But in a few patients, their bodies are not able to handle it, and we have to stop or change and do another different type of drug or treatment. But for majority of patients, they handle the treatment well, and we do take necessary precautions. We monitor the patient's health. We do monitor how their body parts are handling. So we're looking at our bone marrow, we're looking at our liver, our kidneys. So we always do regular blood tests before each chemo, just to make sure. We also check the heart to make sure that it can handle the treatments. So that is mitigating the risk of the chemotherapy and the radiation. So we embark on this journey, and we do regular monitoring to make sure that the patient is handling the treatment well, and also that the cancer is responding. So the scans that we also do regularly. And once we have finished the treatments, we rescan to make sure that the cancer is clear. We say a patient is in remission. So remission just basically means there is no evidence, visible evidence of cancer, but we can have microscopic disease that is within our blood. So hence the need for that follow-up over 5 to 10 years. So I always stress the importance of that. So even if you're feeling well,
just
every
come
6
through
months,
anyway.
let's do those blood tests to check to see if there's no cancer activity. Let's do those scans to just make sure that there is no cancer activity. So if we pick it up early, and we can do something about it. Yes. And whether Zimbabwe is ready or if we're able to actually manage, it's an issue of resources. We are resource constrained. So a lot of patients, unfortunately, can't start the journey. They're eager to start. You know, I had a patient that was saying, you know, I'll go and sell my car, and we start on the treatment. But unfortunately, after having sold their car, $2,000-3,000 later, they were only able to do half the treatment. And the next thing is, do I now need to sell my house? But if I die, where will my children stay? So these are things that a lot of patients battle with, and we have to discuss, and we see, and we look for the best way of managing the patient so that they're able to finish treatment. And we're lucky enough, we have a government sector that works. So that's Pariringatwa Hospital, Pilo Hospital, also Harare Hospital offers cancer treatments. So a patient who's not able to afford private care, they do get access, and treatment at the government hospitals is subsidized. So they do get it at very low prices. So that's your chemotherapy, your radiotherapy, and patients are able to actually finish their treatments. So we're happy that the government is doing a lot of work to make sure patients access cancer treatments.
Okay. So you went through all this treatment, and how did you feel as you were going through these, you know, through the chemo, through the radiotherapy? How did you feel?
You know what? I developed a very good relationship with my doctor, with the medical team. I would ask questions every time, and every time if I had something like the treatment, because you remember I researched about the cancer, the side effects of the treatment that I was getting. I remember at one time my doctor had to change the treatment because I think it was too much on my body. So I think most people they're afraid of their doctors to tell them that this is what I'm feeling it's an abnormality. So for me, every stage I was talking to my doctor, to the whole medical team. So it was easy, and some of the vomiting, I lost my hair, I was expecting it, so I was not afraid. So also the presence of my family, the strong support system for my family, the medical team, as I said, the prayer groups, and also the Reach for Recovery, the one doctor was saying, talking about from Cancer Association of Zimbabwe, and also just listening to other cancer survivors. It actually helped me travel my journey.
So you get that screen that says, okay, so right now you are clear. How did you feel at that moment?
I said to myself, already. I wasn't expecting it. You know why? Because in my family, I'd lost to my father and my brother. So, you know, you are fighting, but, you know, the message, when the message came, I was very happy.
Right.
I was very happy.
Right.
Yes.
And as you were going through your treatment and you were asking all these questions, did you at any point think, Ndabo, I'm tired, I can't do this anymore?
No.
No?
Yeah.
You kept going?
Yeah, I kept going. I was fashionable about it with my bold hair, my earrings.
you had that positivity
and then
about
one time, where I was getting treatment, they were just saying, Miss Malaika. So, so I would look forward to go there. And I remember at one time, I was going there on a weekly basis for 12 weeks. So I had to make that place my home.
Right.
Yeah.
Right.
And I'm happy that they welcomed me and it made it home for me.
Okay. All right. What difference does that make, though? Your positivity, your attitude, or the negativity? What difference does it make to your treatment or the process of your treatment?
Yes, it makes a huge, huge difference. So we do find, you know, when we see patients, that's the thing, that somebody is thinking because they've just had a diagnosis. The first job we need to do is actually lift them up from that. And the only way you can lift them up is through that positivity, the hope. That's what keeps us going. And the treatment is not easy. A lot of people, they do complain it hurts. They have joint aches, the body parts. You know, you ask, where is the pain? You're like, it's everywhere, doc. Yeah, it's everywhere.
Right.
So you do find with that now, if mentally you are down, then you're not able to keep going from day to day. You know, there's some patients that you'd find their date for chemo has come and they're not, then you have to call them to say, where are you? Please come through. And you can just sense that mentally they were thinking.
Right.
But as health professionals, we've got to reach out sometimes because there are times when one is not strong, but we have to reach out. We've got to hold our patients' hands and help them through because we know the benefit of completing the treatment. So really, we try and foster that positivity as much as we can.
Now, just very quickly, Doc, Kudakwashem Nemo on Facebook wants to know what impact COVID has had on people getting access to their treatment, especially in a timely fashion, because this is something that is very time sensitive as well.
Yes, we have faced quite a number of challenges with COVID, especially when our figures were peaking and we're losing a lot of patients. So a lot of resources were going towards COVID. So cancer sort of, you know, took a backseat. But unfortunately, once cancer takes a backseat, then it continues to grow. Some patients were not able to travel because of the road restrictions. And even with the hospitals being overwhelmed, theatre time was an issue. So one has a lump that needed to be biopsied or removed, and they were told that the theatres were closed. They had to go home. 2-3 months later, they came back with their lumps having grown. So we did struggle quite a lot, especially with the first lockdown last year. A lot of patients now ended up coming with advanced cancer.
Right.
Yes, but we did learn our lesson from there as medical professionals, and we put in systems in place to make sure that even with COVID, that cancer would actually take priority. So at the government hospitals, the cancer services continued. There was not lockdown there. We didn't close. So patients were still getting their chemotherapy, their radiotherapy, their surgeries, and even in the private sector. The only issue that patients are still struggling with, a lot of the times, we have to do a COVID test before they have chemotherapy or radiation. Why? It's because we say that if you do have COVID, then your immune system can be lowered by chemotherapy. And we know that the complications of having COVID when your immune system is lowered is way worse. So if you have COVID, we'd rather that you recover first, get strong, and then we put you on chemo. So a lot of patients, before their chemo, they have to have a COVID test, and that costs $60 to $80. So that's increasing the cost. So that's where our patients are struggling. So we're kind of hoping that we can have assistance from the government and even the private labs to reduce the cost of the COVID test for cancer patients.
Right, right. Now, unfortunately, we are out of time. But before I ask you the final question, Doc, would you please give us a demonstration of a self-examination?
Yes. So with self-examination here, we're saying we want you to get to know your breasts. So even from young girls, teenagers, all the way up to the elderly women, you need to examine your breasts every month. So if you're still menstruating, you need to wait a week from the day that you start menses, because just before your menses, the breasts are tender and very lumpy.
Right.
So it becomes a little bit tricky. So wait until you finish your menses when the breasts are softer.
Right.
But after menopause, then you can, choose a day of the month that you stick to. So once a month, you look at your breasts in front of a mirror to see if any change in their shape, their size. So if they're bigger on one side, no symmetry, it could mean that there's something growing in there. You're looking for any skin changes when you're looking in front of the mirror. You're looking also at your nipple. Is it drawn inwards? That might show that there is a lump in there pulling that nipple inwards.
Right.
So, or a rash or anything that you see on the breast. So you look at them and then you lie down. When you lie down, we want to feel our breasts. So in a systematic manner, you can start at the top, just pressing deep, going round the breast, methodically, not missing a part. So you're going in circles, inner circle, going inwards, all the way up until you get to the nipple area.
Right.
Then you press deep to feel for any lumps that we're looking for. Okay, so anything that you feel, please, you go and you get checked. Not to forget the armpit. So you raise your arm and then you start pressing from the corner of the breast all the way into your armpit. You're also feeling for any lumps within the armpit. Like I mentioned, those lumps can spread to the armpit.
Right.
Not to forget the nipple. For some women, the lump grows and it affects our ducts, our milk ducts.
Right.
And there's blood that can come out of the nipple or discharge. So you press the nipple for any abnormal discharge.
Okay.
So if you're not breastfeeding, you should not be having a discharge, especially if it's a bloody discharge. Please get it checked out. Also, not to forget, if you're in the shower, when you're soapy or in the bath, that's even easier to do that breast self-examination. So lying down when you're in the shower, in the bath, you also repeat
can
the
do
same.
that.
Yes.
All right. Now, are there lumps that should be considered normal, or are all lumps at all abnormal?
Yes. So that's the importance of doing this regularly, especially when you start at a young age. So you get to know your breasts. Generally, there's some women with what we call dense breasts, so they just have lumpy breasts. So if you're examining those breasts regularly, so for you, when a change happens, even if it's small, you're
know.
able to pick it up. And the importance of doing it every month, around the same time of each month, you will be able to pick up. Besides self-breast examination, we also advocate for mammography, which is a special x-ray that we do. You squeeze the breasts between x-ray plates, takes a picture. We check to see if there are any special deposits on that picture, which can point towards you having breast cancer. That special x-ray, we usually do it from the age of 40 years of age onwards. Why 40? Because our breasts are less dense from the age of 40. When they are more dense before 40, then we can pick up abnormalities that may look abnormal when they're not.
Right.
But if you have a strong family history of breast cancer, then we can actually start it from the age of 30. And we can do a special test called an MRI scan, which is more expensive, but it works for women with dense breasts, the younger women.
All right. Now, unfortunately, we are out of time. Haji, I'm going to ask you in conclusion, from your heart to the heart of someone who is currently fighting right now, what do you want them to know as they go through their journey of fighting breast cancer? That's number one. Number two, somebody who hasn't taken it seriously, what also would you want to say to them?
Okay. For those who are in the journey, just to tell them that there's light at the end of the tunnel. It's not a death sentencing. There are survivors out there. You can be one of them. Just have hope, to be determined, fight the journey, and you will reach where you're going. And for those women in the community, love yourself, examine yourself every month. You know yourself better. You're the best doctor to yourself. Any changes, seek medical attention immediately.
All right, thank you. Doc, as a community, how can we make more of a difference in this fight against breast cancer and ensuring that people start to come in a lot earlier if they discover anything strange?
We need to just get the word out there. We need to just keep it in people's faces that there is this disease that can affect us. So a lot of the times I'm challenged to say, what about women in the rural areas? In the towns with access to ZTN, radio, but in the rural areas, we need to do a lot more outreaches. We need to train the community health workers so that they train and teach their women in the rural areas to learn to love their breasts, to know if any changes come up. Those self-breast examination is cheap, just a woman just examining her breast. It's not like, you coming for a test. So there is a lot that we need to do, and just to remember that early detection does save lives. Yeah.
All right. Thank you very much for joining me, ladies, and thank you for the insightful discussion. I hope that this has added something to your knowledge for today. And of course, ladies and gentlemen, because gentlemen, you can get breast cancer too. Make sure you are checking on the girls, ladies. Make sure you are self-examining as often as you can. You're loving yourself, as Haji has said. And if you are currently fighting breast cancer, you are not alone. We are with you. We are fighting with you, and we are praying for you. My name is Candice Mwakaliele, from myself, the crew behind the scenes at ZTN. Be kind to each other, but be kinder still to yourselves. We'll see you next week.